led by Assistant Chief Anderson, is going to be telling you about our Youth Opportunity Center. And with that, I'll let it go.
Thank you.
Good morning, Board. I'm Jordan Anderson, the Assistant Chief Probation Officer. A little history on myself is I've worked with the county for 19 years, starting at Barrow Boys Ranch. I've worked with at-risk youth through my career there as a counselor, and transferred over to the juvenile hall as a supervisor, and then eventually promoted to a facility manager, and then now the assistant chief. And I currently supervise and manage the Youth Opportunity Center, and the Reentry Service Unit. So thank you again, Board, for allowing us to present the Youth Opportunity Center today. I also want to thank the Reentry team, Ben Valley, Amber Hartwick, Shauna Wilson, Robert Areola, and the program coordinator, Tamara Sweeney. Although I'm presenting today, they are the backbone of this program and do the hard work every day, trying to make a difference in young people's lives. So what is the Youth Opportunity Center? It's a safe place for youth to pro-socially engage in a centralized location for them to receive needed services, where we can challenge behaviors and thinkings of the youth with creating goals of higher responsibility, accountability, and opportunity to change the course of their lives. We do that with, first and foremost, building a strong, positive relationship and rapport with the youth and their families. We work closely with them to assess and identify their strengths and their weaknesses as we develop their case plan. And over the next 6 months, we continue to work closely with them to redirect or reassess their needs and of the youth and make any necessary changes as they move through the program. So we can't do this alone. When we don't do it alone, some of our community partners are here. We need our community partners and our volunteers to partner with us to work with these youth. So we are looking to serve and target youth between the ages of 12 and 17 years old who need additional support, resources, and life skills, some additional guidance with family relationships, school attendance, and other life challenges. What that process looks like is the youth, parents, guardians, agencies, community partners can refer those youth to the Youth Opportunity Center. That QR code up there is quick access to that referral process that can be used to start this. So all those initial referrals go to our program coordinator, who review them and bring them to the MDT, the multidisciplinary team, for review to make sure that these youth and families aren't receiving redundant services. And then ultimately, if they're deemed eligible and appropriate, they continue that process with the Youth Opportunity Center. If they're ineligible or not appropriate, we'll still work with those youth and families to refer them to other agencies, community-based organizations where they can receive those needed services. So some of these programs that we offer here at the Youth Opportunity Center. So we have our Forward Thinking Journaling series, which is a cognitive-based series that uses evidence-based practices and strategies to assist youth involved in making positive changes to their thoughts, feelings, and behaviors. They use that, applying that information presented in the journaling to their own lives to help achieve their goals for responsible living. Some of the life skills that we're looking at offering as well is like financial literacy, meal preparation, personal hygiene, laundry. Our Check It Club is offered by North Coast Red Crisis, and that's about establishing healthy boundaries in relationships. So we're also looking at addressing the health and wellness needs of the youth. So the most recent survey shows that the student population of Del Norte County has about 6% that are eligible for homeless services or at risk of homelessness. So we're going to be offering shower and laundry services as well as personal hygiene. So these youth don't have access to laundries or shower services. With that comes a hygiene poverty. Hygiene poverty can affect their physical and mental health. These adversities cause young houseless struggles to succeed at school, with work, or virtually any other place. Another part of our program is community service. Working with community allows youth to give back to the community, gain responsibilities, gain skills and job experiences, and have a positive pro-social engagement. Some of those community services that we've already established are listed here. But volunteering in the community provides the youth the opportunity to meet community members and business owners. They could be instrumental in guiding youth towards their future. We know that all it takes is one consistent, positive influence in a young person's life to really help steer them in a different direction. And we are always looking for new sites and partnerships. So again, that QR code can be a point of contact. And at the end here, I'll share some other point of contacts if we have people that are interested. So some of the pictures here that some of the community services that we've done, we've been at Inderts Beach on South Beach doing some cleanup here. Camp Berry has also been a great place for the kids. They love working with the dogs and the puppies. They get to do some socialization with the animals, leash training, basic commands. Another great one here is our Adamedium House. They've gone there to visit with the residents there. The youth get to connect with them, and they get to provide some unique perspective and insights on life. Over the holiday seasons, they were there passing out cookies and holiday cards. We were involved with the plant and seed exchange at the fairgrounds. Good chance to play some bingo and again some more holiday cards there. So we've been making some modifications to the facilities, and this will give you guys a kind of brief insight to some of the changes that we've made here. Here in our lobby, we've been able to change out some seatings, include some backpack lockers and cell phone lockers. This is our reception area. We got a sectional couch, some art decor there. We also have TV, books in the reception area. This is where the youth would kind of check in before they go on to going into their community service or going into a group that's being held in the facility. So this is where if they were going into a small meeting room, this is where they'd be meeting and doing one-on-ones or in a small group. Our recreation room, we've included a PS4 there, game to host game nights, art and art supplies, a reading room, kind of a larger recreation room for slightly larger groups. And our classroom, this was for large groups and meetings where we have audio, video, and Wi-Fi connections if needed. And our full-size gym, where they can do volleyball, soccer, kickball, basketball. Some of the plans here is bringing in some acoustic tiles and a traversing rock wall. We have a fully stocked commercial kitchen. This is where we'll be looking at building up some of those life skills and job skills of culinary and meal preparation to help them gain skills in how to provide healthy and safe meals. So moving forward, and we want to continue building with our community-based organizations, continue trying to reach out for volunteers that create a space for our youth. We're in the works of creating our, getting our Paxton Patterson instructor on board, which is like construction vocational skill building. And some of the places that you might have seen us already and where we plan to be are school sites. We've been there at the end of last school year, and we'll be there again as we reach out and partner with our schools. Wellness Summit, Water Safety Day. We have plans here to be in the trunk or treat of 2024 as well. Here's our contact information for, again, that QR code for the referral process. Our email there and phone number for any community-based organizations or volunteers that are interested to partnering with us, and our address. That concludes our presentation today. Do we have any questions or comments?
Just one question is, what is your current load as far as individuals being funneled into the YOC?
Total, we're right about 20 currently, and that's being built out. So as we've gained some momentum in that and adding a few youth that have wanting to receive services there, and we continue to try to reach out and gain more there.
Who are your community partners?
Community partners. So currently we have like behavioral health comes in and assists us with a anger management group. We're working with yeah, let me, oops.
Number 5.
There we go. All right, so at a glance, here's some of our community partners.
The reason I asked this rhetorically, wanted to go into a little deeper. Like, for instance, take one of the community partners. How are they supporting the efforts? For instance, Delaware County Office of Education, I see on there, CASA, Tolowa. How are those partners integrating into the program?
Yeah, great question. So this is this program is like building the plane in flight. So these are partners that we've had initial conversations with about partnering us and how they can. So most recently, we're talking with like public health about providing a tobacco use prevention program there at the Youth Opportunity Center. Goals with that would be talking with our school district and school sites about if they are seeing a young person that's maybe vaping on school grounds, and how we can tie those two people and provide a localized resource so that the school has somewhere for those kids to address that issue and that need, and we can hopefully provide that in a centralized location. Delaware County is a very spread out in rural county, and so trying to provide those in a centralized local facility is going to help overcome some of those obstacles for those transportation issues that we see with our youth.
No, I appreciate you not only expanding on that, but providing that example. Obviously, the youth vaping issue is quite extensive, especially at the high school. So if there's a resource and a partnership, which you described, that could be effective at curtailing some of that activity, that would be outstanding. So I appreciate you expanding on that a little bit more.
Yeah, and that's definitely a need of our community. Current data reflects that Delaware County youth are about twice as high for nicotine use. And so that's something that we definitely see the need in our community and want to address.
So the school district has homeless youth services, and it's ran by Pam Wilder over off of I don't know.
Yeah, the Epic Center.
Yeah.
Yes.
How are your services different, and are we doing duplicative services, or are we working in partnership with them?
So far, the conversations that we've had with her is to partnership. So she helps with the care closet, and she's shown interest in to help establish that care closet there at the Youth Opportunity Center. Specifically, from what I understand, so a lot of the clothing resources that she has are gauged much to a younger population. So we'll be trying to gear our care closet to that 12 to 17 young adult population.
Okay. Yeah, 'cause we're not a big enough community to have a lot of duplicative services. So I was just curious, are we working in tandem with them to provide something a little bit more unique than what they're already providing? It sounds like you are.
Yes, and she has multiple care closets. Those care closets are, I believe, at every school site. So we'll just be another additional site and resource.
Okay, perfect. And then I've had this concern. I'm going to always have this concern just based on my 30 years of training in this area. But when you have justice-involved youth and then you have self-referrals or parental referrals, how are you separating those two out? Are you combining them in the resources within the programming that you're doing?
Well, safety always has to be addressed with specific needs, and so those needs, as they're being assessed for a specific individual, are going to be referred to a specific program. These youth are already in our community. They're already integrated into our schools, into our churches. They're working at the gas station or in the grocery stores. So all the groups are always supervised. There's always an
Yeah, that's not
staff member.
my question really is, and there's just so much data on it, is that when you integrate a justice involved based on whatever varying risk level with a non-justice involved, you're actually doing more harm than good. So I'm just curious, when you guys approach this and there's referrals for non-justice involved, are you keeping them separate from the justice involved youth?
It would depend on the program that they're being assessed and referred to.
Okay. Thank you.
We are at 11 o'clock.
Having coached, youth sports, football for many years, you can see kids come in that are at risk, I guess, or have maybe a different home life than the average kid. And by the end of, the football season, structure and the positive, role models being there, it's like a switch has turned in them. I mean, it's night and day comparison to when they started. But at the end of football season, they're kind of just left, and they go on to back to where they were or whatever. Have you thought of, or is there a way to become more involved with like the either the youth or the high school sports programs, and how can you incorporate that, and so they have a place to continue on after this?
Yeah, that's a great question. So I think we touched on it here in this slide. Some of the discussions and plans for future goals is looking at those sports teams, how to provide those after activity engagements. So that is something that we've been looking at, and again, trying to build that plane in flight. So having the kids here to have the programs and the kids at the same time. So
How would you get that community? Because currently it's a referral type basis, but if there was somehow to have a presence that maybe they want to refer themselves.
Yeah, absolutely. And the youth can start that process by referring themselves.
Okay.
Mm-hmm.
Yeah, I was just curious, seeing that one of our partners was the art gallery there on 2nd Street. I was curious, how many volunteer groups or people come in and facilitate groups with the kids, or like art sessions or anything else? We have a pretty good group of people that come in and visit this?
So with the 2nd Street, we helped set up a couple of their events, and they are interested in coming in and partnering with providing that art. We haven't nailed down exactly who or how many, but we would like to do that at least once a week and have somebody come in from that art gallery and provide some basic art instruction to our youth.
Sure, yeah, I just noted that the art gallery was there. I just wondered if there was anybody else that was coming in and teaching the, like you mentioned the cooking classes. Is that an outside resource that comes in, or is it something that you guys do in-house?
We're currently doing that in-house.
Yeah, okay.
Yeah.
Thank you.
Thank you.
Thank you.
Do we have any public comment? They're running out real quick. See no public comment? That'll bring us up to the 11 o'clock item, and we have